One of the big things that's happening around Nigeria and Africa is the fact that a lot of the responses are centrally located, and this means that a lot of the response is urbanocentric, and we're worried about dissemination into the hard to reach, the very vulnerable communities where people may not even have access to this information. There is also a lot of rumors and myths and misinformation going on. Some of the rumors that we have heard frequently is COVID-19 is a disease of the affluent. And so if you are not affluent, you cannot be infected by COVID. So when they have a suspect, people are asking, how much does he have as bank balance? And if they do not think that he's rich by the standards of Africa or Nigeria, then they do not think he can be infected, and this is dangerous. People also say you can be healed by garlic and ginger. So people have taken in copious amounts of garlic, people have taken in copious amounts of ginger to be able to act as a cure. Something else that is quite interesting with some of the rumors we hear in Africa is that COVID does not affect Black people or young people. That means people are not looking in their communities to know if there are people who have been infected. We have incorporated COVID-19 messaging into our programming through our partners, and we're disseminating these through traditional structures in the communities where we work. In Nigeria, we're using radio jingles. We have just taken the messaging from the central government. We have translated this into local languages and put them on the local radio stations. We have messagings that are going on WhatsApp, using face leaders to disseminate SMSs to people, just generally pointing them in the direction of correct, consistent, simple messaging so that they are clear about the facts on the transmission, on the mitigation, and on infection prevention. In Africa, a lot of people still do not have access to, do not live above the poverty line. So the implications of a lockdown are enormous in terms of the economy. How is it going to impact on families being able to get a meal? How is it going to impact on families having access to the things they need to continue to be alive and to continue to be able to function as a family as a result of the lockdown? We hear that there is an increase in the amount of gender-based violence against women because of the lockdown and the close proximity. So to donors and supporters, what we would be looking for, it is being able to support our communities, our partners to disseminate this messaging through faith leaders, through community structures, so that people have correct, consistent messaging. At this point, we would also be looking to be supported to get materials for infection prevention and control. We're looking at support to get hand sanitizers, to get soaps, to even build capacity for our women to be able to locally produce soaps, to produce face masks, and we can build hygiene kits so that it's sustainable, it's homegrown. We will be grateful to be supported to provide clean water so that people can wash their hands and mitigate infection transmission. We'll also be working with partners to ensure that healthcare workers have the preventive gear to be able to manage people who come in who may have COVID. Would also like to be part of a policy campaign at national level, to be supported, to be part of the CSOs by engaging with the government at the center to make sure that community voices are heard in planning for the response towards COVID. We need to be prepared from this time when it still looks like we can control it. We do not need to postpone our mitigation. The time to act for Africa is now.